Everybody, thanks for joining us for the second of our three-part series of videos from our July 2020 meeting, which is a panel of Tennessee urgent care doctors as they put together a set of coherent suggestions to the Tennessee governor based on what they see happening in the state of Tennessee.
Welcome, everyone. I am here today with critical care physicians representing every corner of Tennessee to deliver a unified message. Immediate action is needed by Governor Lee to correct Tennessee's failed response to the COVID-19 health crisis. As COVID-19 swept the United States, more than 2,000 Tennessee doctors have regularly offered their counsel to Governor Bill Lee, and we've been begging for science to drive decision-making and not politics. We were right about the stay-at-home order. It worked. It slowed the spread of COVID-19, and it bought Tennessee valuable time to address this health crisis. But instead of using that time to get things under control like many other states, Tennessee squandered it in rushing to reopen without a more cautious approach to slow the spread. Instead of leading in this crisis, Governor Lee's most recent executive order puts the responsibility on county mayors to lead while tying the hands of many city mayors who want to do more to protect their citizens. Now things are much worse. In June, Tennessee COVID-19 hospitalizations soared by 70%, and ICU bed use has increased by 56%, as you can see in this chart. As we physicians said in April, the economy will not reopen successfully if the virus is not contained. And that is still true today, and we need leadership to do that. So in order to contain this virus, protect lives, and get the crisis under control, Governor Lee must do the following. First, we must issue a state mask requirement. When people refuse to wear masks, it does not protect their liberty. This selfishness is a threat to the liberty of everyone else. When people ignore speed limits and drive recklessly, they are fined because they are endangering others. When people drunk drive, they are fined as well because they are endangering others. In this health crisis, not wearing a mask and not staying apart endangers the lives of countless others and prolongs the health crisis. Secondly, we must make the Tennessee Pledge protect the public by requiring employers to have safety measures in place to keep people physically separated by 6 feet and masked or face consequences when they don't. If an employer is endangering the public needs a way to hold them accountable. At the very least, the state's administration should investigate businesses where employees or the public have expressed safety concerns. And third, we must give mayors the power to protect the public health in their cities. When cities want to do more than their county or the state, they should be empowered to lead. Now I would like to introduce 3 of my critical care colleagues, each representing East, Middle, and West Tennessee, to share what they are experiencing and why action from our state is so urgent. Dr. Jigme Sethi will start off representing East Tennessee.
Thank you. Good afternoon, and thank you for the opportunity to allow me to make a few personal observations. I'm here in Chattanooga, and here we have 3 hospital systems that have shared the burden of taking care of patients with COVID-19. Our own hospital has admitted and cared for about 170 patients, give or take, and about a fourth of them have come through our ICU since we admitted the first patient on March the 19th. We haven't, thankfully, had a surge, but a steady admission rate, except for the past week, in which the admission rate has picked up fairly significantly, and over this weekend, it has really gone up a lot. Now, I've been a practicing clinician for 35 years, and I want to say that as a critical care physician, I have not come across a disease like this. The pathophysiology is unbelievable. The hypoxia we've seen has been unlike anything we've ever seen. We've had patients on 100% vapotherm at 40 liters a minute with, on top of that, 100% non-rebreather face mask, and their saturations are still in the 80s. I had a young man in his 30s who had a respiratory rate of 60 breaths a minute. We put him on BiPAP and he kept breathing at 60 and his minute ventilation was 24 liters while his PCO2 was only 40. And these are both people, these examples are examples of people who've actually done okay, and it's taken all the courage we have as clinicians to not intubate them. But not all of them have been so lucky. We've seen patients who've got a compliance of 9 milliliters per centimeter water towards the end. Their lungs have literally turned to stone. And for those who think that this disease only affects those who have comorbidities or are elderly, our own experience has been that yes, we've had our fair share of the elderly with comorbidities, but we've lost a surprising number of young people, men mostly in their 30s to early 50s, who have had no such comorbidities. And we've thrown the book at them. Convalescent plasma, remdesivir, decadron, heparinization, aspirin, proning, paralysis, prostacyclin, and for many of them, nothing has worked. And for the first time in 35 years as a clinician, I feel totally powerless in the ICU. We wish for the best and do what we can, but we have no confidence, or at least I have no confidence that what I'm doing is really making a difference for those who are suffering. And those who died, the grief and sorrow of these needless deaths has been devastating to us, to observe, to our nurses, to our respiratory therapists, indeed to all of us who've taken care of these patients. They die alone, without their families present. No one's holding their hands. They're not connected except perhaps on Zoom or FaceTime to their families, who have to grieve in silence. We've admitted couples in rooms across from each other. One spouse has lived, another has died. And this kind of catastrophe and devastating needless death is something that is entirely preventable. If these patients had worn masks or kept themselves socially distanced, or more importantly, if others who cared about them had worn masks and kept themselves socially distant from these patients, they would have lived. This is a medical problem. And even if we have to have a solution for the economy, it has to put medical fundamentals first. We wear seatbelts. We practice safe sex during the HIV epidemic. And now we can't wear masks. All of us burden our nurses, our respiratory therapists, and we as physicians burdened with the sense that one of these days it could even be us. And so I think the time has come to empower our communities and to send the message to each and every one of our citizens that we owe it to our fellow citizens to keep ourselves masked and separated. Otherwise, we'll continue to see needless suffering. Thank you.
Jigme, thank you so much. Next, I'm going to introduce Dr. Murray Ahrens, who will represent Middle Tennessee.
Thank you, Aaron. I would like to echo everything that was said by Aaron and Dr. Sethi before me. In Nashville, we're seeing a significant increase in cases over the last few weeks. At Skyline Medical Center, where I practice, we've been having approximately 30 cases, almost an entire floor filled with COVID patients every week lately. And while people think that although there's more cases that people aren't getting as sick or dying, that's really not true. I think we lost about 7 patients to COVID last week. And as was said before me, it's incredibly frustrating because often you feel helpless to stop the progression of this disease. But one of the things that I find by far the most frustrating is the sort of two worlds that I live in. I come to work and I take care of these critically ill patients, and we do everything we can to save their lives spent incredible resources, time, energy, emotional effort. And we've had patients. I had a 90-year-old woman who flew up here from Florida and contracted the disease. She got sent to our hospital because we were one of the early adopters for convalescent plasma and remdesivir. And when she came to us, at first she was on no oxygen. By day 2, she was on a liter. Day 3, she was on 2 to 3, and so on. It progressed until eventually, as everyone has seen who's taken care of this, she eventually died. And the part of this that's so sad is she died because why? Because she was exposed when any physician would have told her she shouldn't have taken the risk she took. She shouldn't have been around a lot of people that didn't have masks and were in social distancing. I'm seeing, just as everyone else is, large numbers of young people who are becoming critically ill. And the thing that frustrates me again the most is when I leave the hospital, I enter this other world where so many people that I come in contact with will say, well, I know the virus is out there, but I don't really think it's worse than the flu. I don't think it's as big a deal as people make it. I don't really believe in all of that. And it's this message that's getting sent by many of our leaders that gives people the idea that it's really not that bad, that we're exaggerating it, that we have some other agenda. And until the government makes it clear that they take it seriously, I don't think that your average person, or at least a significantly high enough percentage of average people, are going to take it seriously. And until that happens and everyone takes this seriously and knows that they can give it to someone, they can get it, they can actually lead to someone else's death, then we're not going to make any significant inroads until we have a vaccine, and no one has any idea when that's going to be. I've had people come up to me, even as a physician, a critical care physician taking care of these patients, and I will tell them how bad it is, and they still look at me like I'm not telling them the truth, like I have some other agenda. And it's this, I've never had this in my whole career where people didn't believe what I was telling them about a disease. And this has been created by people in government and people in the media. And we need our state government to send a message loud and clear that they believe how serious this is and how dangerous it is, and how they need to play their role in helping us stop this. We can't do it as physicians on our own.
All right, thank you very much. And lastly, representing West Tennessee, I'm going to ask Dr. Jeffrey Wright to speak for a moment or two.
Thank you, Aaron. It's awfully hard to follow Dr. Sethi and Dr. Ahrens. They've spoken very eloquently, but I'd like to echo some of the things I heard both of them say. Certainly, like both Dr. Sethi and Dr. Ahrens, I've not seen anything like this in the 20 years that I've been doing critical care. I work in a large 700-bed hospital. 1/7 of our beds are now filled with COVID positive or suspected patients. We have 20% of our ICU beds are now dedicated to COVID patients. And this represents about a 110% increase in patient volumes over the last 3 weeks. A month ago, we only had 8 COVID patients in our ICU. Today, we have 26. Shelby County continues to report growing numbers of sick patients, with around 400 new cases each of the last 3 days. I think nurses and respiratory therapists and all the other clinical staff that are working in the hospital are really bearing the brunt of this disaster. The nurses in particular have to spend hours a day in the ICU with a given patient. The nurses feel isolated themselves. They experience the same thing that Dr. Ahrens experiences. When they leave the hospital, they have to be around friends and family who think they're making it up and inventing drama. They worry about taking COVID-19 home to their families, as do we all. And as Dr. Sethi mentioned, there's a huge misconception that this disease doesn't affect young and healthy folks. Sadly, we've already lost a number of young adults in our community, and many of others have had prolonged ICU stays. I remember one of our first and earliest ICU survivors was a healthy 40-year-old rancher. And he actually, when he was discharged, he was too weak to walk after just a 3-week hospital stay. and so had to go into rehab. Today, our most critically ill patient is an otherwise healthy 22-year-old woman who's been hospitalized for 5 weeks and remains on full ECMO support. She came to the emergency room. At the end of her first day, she had low oxygen saturations, really just barely needing oxygen. And by the end of her second day, she was on life support. And sadly, her family has been unable to be at her bedside for most of the stay, frustrating the patient, frustrating the family, and frustrating the whole care team. Those of us working in hospitals and ICUs are frustrated by the increasing politicization of public health policy. We are frustrated by the denial of science and what we've learned about this terrible disease in just a few short months. It's frustrating to see people ignoring the social distancing and mask wearing recommendations, which we know helps prevent the spread of the virus. Every day, the nurses, respiratory therapists, and hospital housekeepers are literally putting their lives on the line to take care of the patients that have this disease. And like Dr. Aaron so eloquently expressed, it's frustrating to walk out of the hospital and go to chat rooms on social media or visit with friends on the phone, and they'll say, well, it's not really all that bad. You're kind of exaggerating. You're being a drama queen. Well, no, it's terrible.
Very good. I want to thank our 3 speakers today. Very impactful, very needed messaging here. And I would like to take a moment today to close by reiterating that immediate action is needed to get COVID-19 under control. This is not an urban county issue, but it affects our entire state of Tennessee. We need Governor Lee to issue a mask requirement for our state. Science has proven that masks reduce the spread of virus. Secondly, we must make the Tennessee Pledge protect the public by requiring employers to adhere to safety measures. Places and people that endanger others must be held accountable. And then finally, give the mayors the power to protect public health within their cities. Thank you. Wear a mask, wash your hands, and stay apart. Now we are going to open it up to some questions and answers, but I know that some of my critical care colleagues have to leave to go back to their patients. I cannot thank them enough for this show of unity today. Justin?
All right, our first question is from Brett Kelman. Go ahead, Brett.
Hi, everyone. Thank you again for making yourself available for this and for your public comments. I have 3 quick questions. The first 2 are for Dr. Millstone. One, can you give me an example of a city where you feel like the mayor would take more action if they were empowered to do so? 2, it sounds like your main concern with the Tennessee Pledge is that it is currently optional. If the guidelines of the pledge were to become mandatory, would the components of what's in the pledge be sufficient? And then 3, I had a question for Dr. Sethi, who I believe said patients' lungs were literally turning to stone. And I want just a little bit more information about what that actually means, because I want to make sure we're not just using, grisly overkill, or if that functionally means a medical thing.
Very good, Brett. So I'll answer the first 2. The first question is really, where to go from here. And, obviously, I think we have to understand that if you look back at the beginning of June, 33 of our counties had only 1 new case per day per 100,000 residents. As of this weekend, less than 5 counties have just 1 new case per day per 100,000. So this is clear that this is a statewide problem, and many cities have echoed that they want to do more. So the city of Chattanooga, for instance, has said that they would like to do more to protect their citizens with a stronger mask mandate. Regarding the Tennessee Pledge, we really care about the outcome here, the result. And so how we get to that result is that we have to have a unified leader. We've got to be able to mask the public and make them feel comfortable that wearing masks is critical to mitigating the spread of COVID. So I think part and parcel to the pledge comes not only the ability to be able to report employers that are endangering others, businesses that are endangering others, but also to be able to put this mask requirement in place because we know that masking does make a difference. I am going to ask Dr. Sethi to comment on his comment about the lungs of COVID patients becoming like stone. Dr. Sethi, if you want to take that one, please.
Certainly. The function of the lungs is basically to absorb oxygen and wash out carbon dioxide. And to do that, they need to be inflated and deflated, and they've got to do the gas transfer. In these patients over time, not the first day, not the second day, but over time, and especially as they go onto a ventilator, their lungs become full of fluid, inflammation, and they start scarring down. So they become fibrous and very difficult to expand and inflate. And they stop absorbing oxygen and they stop washing out CO2. So it's really almost very difficult to inflate these lungs, even with a mechanical ventilator, to try to push oxygen into these lungs and wash out the carbon dioxide. And normally when you practice lung protective ventilation on a mechanical ventilator, the lungs are kept safe, but we've been seeing lungs pop and having to place chest tubes because the lungs have suffered pneumothoraces, even on protective lung ventilation. These lungs are the most fibrous and scarred I have ever come across over the course of their time on mechanical ventilation.
Thank you both.
All right, next we have Stacy. Go ahead, Stacy.
Hi there. This question is for Dr. Ahrens. What kind of penalties do you think would work to encourage more mask wearing, and who would enforce it? Would it be local police per se?
Stacy, I'm going to just cut in that. I know you asked that for Dr. Ahrens. I'll give you an example from my weekend. I took my youngest son to Davidson County this weekend. We went to the farmer's market, and I'm pleased to say I probably saw 200 people at the farmer's market in Nashville. And all 200 people were wearing masks. And I was so impressed, and I found 3 Metro police officers right there at the entrance, and I asked the sergeant about how they were able to make people wear masks. I mean, how was it so impressive that everyone was wearing masks? And he said, you know, the reality of it is people really do want to do the right thing. They really want to protect their neighbor. They really want to protect their schools, their sporting events, their economy. But then he also added that if I were to have somebody who really was resistant, then I would talk to them about potentially a fine. And because it's a misdemeanor, I have the ability to take that individual to jail. And he said, since I have been enforcing the mask mandate in Nashville, my compliance here in the Nashville Farmers Market is around 100%. Murray, do you want to add a comment?
So I mean, I think I agree pretty much with everything you've said. And I think the practical way would be to hand out citations and fines to people. And if you have maybe more than 3, then maybe you do think about someone having to have some time in jail. I think people make it like this is such an impossible thing to enforce. I mean, the reality is you can't walk down the street without a pair of pants on because we have decency laws. And if you were walking down the main street in Franklin without pants on, the police would pick you up. So I think starting with you know, it could even start with just even a warning, and then a fine, and then progress from there.
Yes, and I would just say, just like I commented at the opening, that it's just like a speed limit. Speed limits are there to not infringe on your liberty, but to protect you from harming those around you, from endangering others. If you go over the speed limit, you may get a warning, but if you really go over the speed limit or a repeat offender, then there's a fine involved. And I think this is a very similar issue to that, very similar issue. Remember, we do not have a vaccine for COVID-19. We do not have good therapy for COVID-19. What we do have in the state of Tennessee is rising hospitalizations, rising ICU admissions, and rising prevalence of this virus.
Dr. Millstone, could I speak just a second?
Please, John.
This is not the first time we've had an illness like this in communities with multi-drug resistant TB. Also, we had legislation where we could have people arrested and be quarantined to receive treatment because they were a public health risk. So this is not the first time, and that should be able to be it should not be that difficult to make legislation since we've been able to do this with multi-drug resistant tuberculosis.
I agree with that. Thank you, Stacy.
Thank you.
All right. All right. And it looks like we have another question from Natasha. You should be unmuted.
First of all, I wanted to just ask Dr. Bolt, when you talked about the multi-drug resistant TB, and that, when was that exactly?
That was in St. Louis during my fellowship. I had a patient who was chained to the bed coming from the jail, and he was hospitalized because he would not take his medicine, and he was proven to be multi-drug resistant TB. He was literally spreading a disease that was untreatable. And so we were giving him several different second-line drugs, but because he had proven many times to not take his medicine, we had a warrant for his arrest, and he came from the jail to the hospital. He was chained to the bed, and the nurse would give him his directly observed therapy. And when he completed therapy, then he could be released. That was in St. Louis, Missouri, about 1988.
Nashville here in the 90s, the same thing happened. It happened here
All
too.
right. I know that we are a little bit over time, and thank you, everyone. Dr. Millstone, if you want to close us out, we'll end this and follow up with folks afterwards.
Yeah, I just want to thank everyone for attending. This is a remarkable event to have critical care physicians from pretty much virtually most of the major hospitals throughout the entire state of Tennessee, representing East, Middle, and West Tennessee. We are unified. We need a mask mandate for our state. We need our citizens to be thoughtful of their neighbor. God bless the state of Tennessee, and thank you for attending today's event.
Okay, everybody, thanks for joining us. Thanks to everyone who has contributed to our speakers, to our videographer. And stay tuned. If you're interested in being a part of our activities at Orion, feel free to drop a line to our website. Check us out on Facebook. And we hope to hear from you. And when things get better, see you at Tam Key Allen Observatory, operated by Roane State Community College. Bye for now.